Hi, and welcome to the first episode of 4-Minute Physio. In this episode, we are going to discuss sensitivity and specificity. So let's dive straight into the terminology. Sensitivity tells us how likely it is that someone with the given disease will also test positive on a test. Specificity tells us the exact opposite, how likely it is that someone without the disease will test negative on a test. Both are directly related to accuracy, which is the ability of a test to correctly identify or rule out a disease. A physical therapy test is considered to have good sensitivity or specificity when it reaches around 80%. The best way to calculate both sensitivity and specificity is by using a simple 2x2 cross table. But before we fill in the numbers, let's have a quick look at this table. In the upper left square, we see our true positives. These are the people who are rightfully tested positive, which means they tested positive and actually have the disease. On the lower right corner, we have our true negatives. These are the people who are rightfully tested negative. On the lower left corner, we see the false negatives. These are the people who tested negative, but actually should have been tested positive. Then, last but not least, on the upper right corner, we see the false positives. These are the people who tested positive, but are in fact not sick. Now let's see what happens when we fill in this table. Let's say that we're doing research for a new shoulder test. We've compared the outcome of this research to a golden standard, and we found that 90 people with the shoulder pathology actually tested positive, whereas 10 people with the shoulder pathology tested negative. 350 people without the pathology tested negative, and 320 people without the pathology tested positive. We now have everything that we need to calculate both sensitivity and specificity by using the equations as shown on the right side of this video. For sensitivity, we divide our true positives by our true positives plus our false negatives. In other words, we divide everyone who is rightfully tested positive by everyone who should have been tested positive, whether they in fact were or were not. For specificity, we do the exact opposite. We divide the people who are rightfully tested negative by everyone who should have been tested negative. And if we do so, we see that this new shoulder test brings us to a sensitivity of 90% and a specificity of 52%, which sounds great, at least for the sensitivity part of this test, but what does it actually tell us? What does it mean for a clinical use of this test? Well, a high sensitivity automatically lowers the amount of false negative people. In other words, we have a reasonably low chance of missing people by running this test, which makes it a good test to rule out the given shoulder pathology. A high specificity means we have a low amount of false positive people, which means we have a low chance of falsely diagnosing people with this shoulder disease, which makes it perfect to identify a disease. The shoulder test in this example shows a sensitivity of 90% and a specificity of 52%, which makes it a good test to rule out this pathology, but a pretty poor test to identify it because of the high risk of false positive test results. Some people are having a hard time remembering whether it was sensitivity or specificity that was good to rule out a disease. An easy mnemonic to use is the abbreviation SNOUT and SPIN. A high sensitivity and a negative test result rules out the disease, whereas a high specificity and a positive test result rules in the disease. That's all for today. If you guys have any questions regarding this topic, feel free to drop a comment below and I will get back to you. If you like this video and want to stay tuned for more, please consider subscribing to my YouTube channel. See you guys in the next episode.